Lindia Willies-Jacobo. I'm professor of pediatrics at UC San Diego School of Medicine. I also serve as the assistant dean for diversity and community partnerships, and I'm the director of Prime Health Equity. When I think about diversity, it's quite expansive, right? It encompasses not just what people look like, not just ethnicity, not just culture, not just language spoken, but I think it really speaks also to lived experiences. And so when we are endeavoring to diversify spaces, it is ensuring that we're looking not simply at ethnicity, background, gender, but we're looking at issues of sexual orientation, for example. We're ensuring that we're addressing issues of lived experiences, of distance traveled. So we're really kind of thinking about it in ways that are quite expansive, which I think is a newish way of addressing issues of disparities. I think historically, especially institutions of higher learning, have often just sort of looked at a person's gender, ethnicity, and culture, but I don't think we can really limit it to those pieces. Those are important because representation matters, but I do think that I'm now trying to be cognizant that it isn't just about diversity, but it's also about inclusion. So it's ensuring that every single person at the table is representing a particular background, culture, thought, lived experience, and that they're really included as well in the entirety of decision making, for example. When I think about health equity, I think inherent is that word, is this concept of justice, and so we definitely want our students to think about ensuring that every single person has the opportunity to access care, and not just access care, but access high quality care, irrespective of their social situation. Currently, we know that the social determinants of health are real, and so as it currently stands in our system, for those persons who, for example, live in significant poverty, these are folks who are not able to access care in the ways that people who aren't in poverty have. And so our desire really is to ensure that every single person, irrespective of their sort of social capital or what have you, do have the opportunity to access high quality care. So that, to me, would be an equitable system.